Assalamu alaikum, welcome back. Now we're going to talk about, again, quite an important issue, and it's a patient right, or actually a group of patient rights. It's about the privacy, confidentiality, and medical records. In this session, we are going to talk about the definitions and the differences between privacy and confidentiality, because sometimes some of us use the two terms interchangeably, and they're not actually. They are related, but they are not the same term. They refer to different things, and we will see in a minute what do they refer. How to maintain the privacy of our patients. We have very good detailed guidelines from the MOH and from the Saudi Commission as well, related to how to keep the privacy of our patients. It's also important to learn how to maintain the confidentiality of our patients, and when it's permissible to disclose medical information, or let me say it as to breach the right to confidentiality. Privacy is more towards a right or expectation to not to be interfered with, to be free from surveillance, a moral right to be left alone. While the confidentiality is the right of an individual to have personal, identifiable medical information kept out of reach of others. So let me say it in a more simple way. Privacy is related to the context within which you take the information from the patient. There should be some sort of a barrier of isolation when you talk to the patient, when you take the medical information or you do examination on the patient. So basically, you need to do this in isolation so that no one else not related to history taking or to the examination have a look or hear or listen to what you're saying. While confidentiality is when you take the information from the patient, so it's your duty to keep this information confidential. That is to say, it's only you as the treating doctor, or those who are allowed to have a look at this medical information are only allowed to have to know about this information. So privacy is more towards the respect of the patient's body, while the confidentiality is more about respect the patient's information. So this is the main issue here that we are going to consider. Privacy. The Saudi guidelines to preserve the privacy of our patients, it's very important before going through the details. There are many measures that should be considered. However, these are the steps or the measures that you should take in accordance with the Saudi context, cultural and religious background. Here in Saudi Arabia, first of all, you need to make sure that examination takes place in isolation from other patients, unauthorized family members, and our staff. That is to say that you need to examine your patients in isolation. Only those who are relevant to the examination, needed for the examination, should be there. For instance, it's not a must, but because the patient has his 3 sons and his wife and his relatives and his brothers, etc. Because they are the family members, this does not grant them that, okay, let's come and attend the examination. This is not the case. This is one thing. It's also about the staff, and this is even more important, because sometimes doctors behave as if they have a carte blanche, as if they have a grant for seeing any patient at any time, and this is not correct. You have the right to see only your patients and not any other patient just because you are a doctor. And this is very important to respect. The second is to provide gender-sensitive waiting and examination rooms. Fortunately, most of the hospitals, I would say even almost all the hospitals in Saudi Arabia, are equipped with waiting rooms for males and others for females, and so for the examination. And even if not, we need to take other measures that to make sure that you are not alone. If you are a male doctor, you should not be alone with a female patient, and vice versa. And we will see how to deal with that. Provide proper clothing for the admitted patients. It's very important actually to respect the patient's body, to keep the patient bodies covered as long as possible, as much as they can, especially if they are unconscious, if they are on the way to operation. If they, for instance, some investigations require that patients get undressed, completely undressed. We need to make sure that they are properly covered. And also for the operations, they also get undressed. So basically, it's your duty as a doctor to make sure that the patient's body is well covered with proper clothing indeed. Make sure patients are well covered when transferred, as we said, from one place to another, whether they are going to an investigation, they are going to the operation room, wherever they are. If you are transferring them from one place to another, so basically you need to make sure that they are well covered. Make sure your patient body is exposed only as much as needed. That is to say, it's not because you are doing an examination. For instance, if you're doing an abdominal examination, and this is quite troublesome, by the way, because, for example, if we go with what the book says, the book says if you want to abdominal examination, so it's just from the middle of the chest at the nipple line down to the mid-thigh, and this is culturally unacceptable. Although you should, academically, yes, examination of the genitalia is part of the abdominal examination, but we should respect the patient's privacy and the cultural issues here. So if you do not need to expose the genitalia, you don't expose them. Even more, if you just expose what you need to expose and nothing more than that. Patients should have separate lifts and given priority in the lifts. And this may be a little bit difficult actually to provide them with separate lifts for them. However, if the lifts are common for the patients and the visitors and staff, so the priority should be given to the trolleys for the patient. Make sure that there's another person of the same sex. And this is what I'm saying. If you are a male doctor and you have a female patient and she does not have has a co-patient, so basically it's your duty to bring or to make sure that a female nurse is attending with you all the time, from history taking to the examination, all through. And this is actually quite important. It's to respect the cultural issues, to respect the religious issues, but it's also important for legal issues. Because sometimes a patient can come and claim that you are, for instance, that you harassed her, or you say a bad thing, or you misbehaved with her. If you don't have someone like a witness beside you, then you could be in trouble. So make sure that there is someone else with you and the patient all the time, especially if you are, and if you are a female doctor as well, it's important to protect yourself. Again, if, some patients may not be decent enough. So always take permission from the patient before examination. This is very important actually. It's to ask for permission. It's not a proper consent, but at least excuse me, I'm going to do this and that. And you should explain to the patient fairly clearly that I'm going to expose your chest, I'm going to expose your abdomen, I'm going to examine the genitalia, I'm going to do this and that. Because it's very, very important to explain to the patient. And allow me to give an example which could be funny but a little bit nasty. One of our colleagues, actually, a very old man, like he's above 60, and he seems to have a prostate problem. And he came to the doctor saying that he has a problem with some kind of urine retention. He cannot urinate normally, and the urine does not flow normally. So what happened is, our colleagues, may God forgive him, he asked the patient, just, turn on your left side. He just, put his knees in a position, and he put on the gloves. And all of a sudden, this poor old man found the doctor's index in somewhere in his body where he would not know, and he just was so shocked. And what a nasty, naughty doctor! How dare you? I'm just as old as your father. How dare you do something like this for me? So basically, this is not because he's a naughty or nasty doctor, but he just, he's used to do this all the time per rectal examination, and he felt like, it's okay, let me see what's up. And then no one would accept that. easily. So it's important to explain to the patient beforehand that what you are going to do, especially if you are examining the genitalia indeed. It's prohibited, yes, avoid keeping patients for period more than required by the procedure. If the examination takes like 3 minutes to 5 minutes or something, don't keep the patients longer than that, because you don't need to do this, because there are other patients waiting, etc. So it's important not to keep the patient with you unnecessarily. It's prohibited to examine the patient in the corridors or in the waiting areas. It's very important, because the corridors, the waiting areas, there is no privacy there, and it's not, so you cannot examine or even take history or ask a patient about her condition or his condition in a public place where other people can hear you. During the examination, no foreign person unrelated to the patient is allowed. Sometimes even if she is or he is related to the patient, and the patient said, please doctor, I don't want my husband now. I want to tell you something. And it happens actually. Perhaps not in Saudi Arabia, women do not have this courage yet, but it could happen sometimes that she doesn't want her husband to know that she had this particular problem. So she kindly asks her husband to wait outside, and then at one point, and okay, I will call you when it's okay. Give patients enough time to expose the part that you are going to examine. That's to say, don't rush the patient. It's just like helping them just to unclothe them or undress them. No, give them the chance. Most probably the nurse is better to leave the nurse to help the patient to expose the part. However, it's, by any means you should give enough time and ask the patient, is it okay, can I come now from behind the curtain, and then you come to do the examination. Only relevant personnel are allowed to enter the examination room. Again, being a doctor does not grant you a right to go into any examination room or to enter any clinic or to go to any ward or to see any patient. So this is about the privacy. If we come to the confidentiality, the basic question is, why should we keep the information of our patients as secret? Yes? Any suggestions? Yes, it's about trust. If the patients do not trust us, they will not come to us. If the patient comes to you and tell you some of his secrets, something that or I won't say secret, but at least something that you don't want people to know about you. I have a problem with whatever. I have asthma, I have vitiligo, I have whatever problem I have, but I don't want people to know. So basically, if I come to you and you, the doctor, tell other people, other family members, etc., you tell them that the secrets, then no more patients will come to you, and then the whole system or the healthcare, the trust in the healthcare system will be affected, if not fully collapsing. Why there is a duty for confidentiality? As I've just mentioned, trust between patients and health professionals is the cornerstone, actually, of the healthcare system. Patients give information about their health in confidence. That is to say, they have the confidence that you, the doctor, is going to keep their medical information secret. Individuals will be encouraged to seek appropriate treatment. If people, for instance, he made a mistake, he had some sort of sexual relationship or something, and he's afraid that he might have got HIV/AIDS. But if he does not trust the doctor or the hospital that even if he is HIV positive, that this will be kept as a secret, then he will not come. So basically, it's very important to build this trust, to make people trust the healthcare system and the personnel and the doctors. So what is confidential? Is it any and each and every information confidential? Okay, all identifiable patient information, whether written, computerized, visually or audioly recorded, or simply held in the memory of the health personnel, is subject to the duty of confidentiality. That is to say, anything, almost anything related to the health of your patient is confidential until proved otherwise. It covers the individual past, present, or future physical or mental health or condition of your patient. This is confidential. Any clinical information about an individual's diagnosis or treatment, what is the diagnosis of this patient, what are his plans of treatment, this is confidential. A picture, a photograph, a video, a recording, audio tape, or other images of the patient, this is confidential. Who the doctors, the patient doctors is and what clinics patients attend and when. For example, some patients need some sort of psychological support, or would say even psychiatric support. He's admitted in the internal medicine ward, for instance, and then if one of his relatives go through or ask the nurse, and nurse will say, okay, you know, Dr. Flan or Flani, he is a psychiatrist, he's seeing. Oh, psychiatrist, why? Is our dad getting mad? He's not competent, there is something wrong with his mind. So he starts thinking about things. And this is actually, it's really, really important to consider. Anything else that may be used to identify patients directly on direct. For instance, like the addresses, the home address, the mobile number, the phone number, all of these should be kept confidential, because it's just tell you who the person is. The past, present, and future payment for the provision of healthcare to the individual, this again should be kept confidential, although sometimes it's not. If a relative wants to pay the bill of the hospital, then most probably he will come and ask if someone has paid the bill or not. So if we want to protect the information, the medical information of our patients, what we should do? First of all, limit the accessibility to the medical records. That's to say, only allowed personnel have the right to go through the medical records. Again and again, I'd say, being a doctor does not grant you the right to open whatever the medical record you want. It's even worse if you are a resident or even you are a medical student. This makes things just worse. Do not discuss the patient's medical information with unauthorized family members. Being a family member, especially in a country like Saudi Arabia where there's extended family, you find a person like mashallah, like 6 or 7 sons, 3 or 4 daughters, like 6 brothers. If all of them, like 20 persons, are family members, it's impossible. It doesn't make any sense that because they are family members, they should know anything about the patient. Only authorized family members. And this should be discussed on admission with the patient. When you start seeing the patient and following the patient, you tell them, who of your family do you want me to expose or to disclose your information to? At least he should take one person. Okay? Do not collect information not related to the provision of care. So basically, it is important that you don't collect information because you are used to collect them. If they're not related, then just don't do it. Set policies. Again, although you as the clinicians may not set policies, but you should help or whistleblow